I sometimes get this question, what options a person has when they are missing a tooth. Usually there are 3 options when a person is missing a tooth. One is a denture, which is something that you put on and take it out every night. Second option is a bridge. Bridge is something that takes help from the front and the back tooth. Once placed in, it's fixed in. You don't have to take it out or put it in. Third option is implant. Implant is something that is placed in your bone, and once the implant is put in, we put a cap over the implant. So what is a denture? Denture is something that you put it in your mouth and you take it out every night. It is in your mouth, but it is not fixed. It is better to have something than nothing, because if you have a missing space there, then the surrounding teeth, they are going to shift and move. The top tooth, it starts coming down. The surrounding teeth, they start closing the space, and that affects the relationship between the top and the bottom teeth forever. We don't want that. So denture is something in place to keep the other teeth in place. So we try to match the shade of the tooth on the denture as per your own teeth so that it looks natural and nobody can say that you're having a denture in your mouth. What is the process of making a denture? We bring you in one day, we take a scan or an impression to send to the lab, and then bring you back after about 3 weeks from that appointment for try-in. What does try-in mean is that the teeth and the denture, they are all in wax. I have a look. If I like it, I show it to you. If you like it, if both of us like it, then I send it back to the lab for them to finally make a denture out of it. Then we bring you back 3 weeks from that appointment for me to give you the denture. We try it on, we see if you like it. If everything is good, then we give you the denture, and then we bring you back about 7 to 10 days after that appointment to check how you're doing. If it's all healthy, then we don't have to do anything. Sometimes the denture might need some minor adjustment here and there, which is totally fine, which is totally okay. I'm going to talk about some pros and cons of a denture. So what are the pros of a denture? Denture is usually the cheapest option out of all the 3 options. And like I said, it is better to have something than to have nothing. Now I'm going to talk about the cons of a denture. Denture is something that is not fixed. You have to take it out and put it in. It kind of puts pressure over the gums, and patients sometimes feel a little uncomfortable with all those forces. That's why we take the denture out every night so that the gums can get some rest. You have a denture over your mouth, so there is some acrylic, that pink stuff or the metal stuff over your gums, and it's sometimes pushing over the gums. Sometimes patients feel that they have some food getting stuck in there, but it's better to have something than nothing. There are different types of dentures: complete dentures or partial dentures. As the name suggests, complete dentures mean when a person is missing all their teeth and the entire dentition is to be replaced by a denture. A person can have a top denture or a bottom denture. A person can need both or just one as well. There are other types of dentures other than complete dentures, which are called partial dentures. What does a partial denture mean? Partial denture means when a person is missing some teeth but have some of their own teeth. It's a denture that goes in, replacing those few missing teeth. There are 2 types of partial dentures: the cast metal partial dentures, or the other side is the flex partial dentures. Cast metal partial denture is the one that has some metal in the structural integrity of the denture to provide strength to it. So usually the cast metal partial denture once made can last you for many years. With the cast metal partial denture, if we make a denture right now, example, you lose a tooth in a year, we can always add a tooth to your existing denture, and that saves you money in the future, because that way you're not going to need an entirely new denture, and it is much easier to get used to a cast metal partial denture. The only negative part about the cast metal partial denture is that it has some metal in it, and the metal shows. So if you are someone who's aesthetically conscious, it might not be a go for you. The other side, we have the flex partial denture. It is all pink and white. It does not have metal in it, so that is the good part about that denture. But because it does not have metal in it, it's not as strong as the cast metal partial denture. Another thing with the flex partial denture is, if you lose a tooth in a year, we can never add a tooth to that denture. So we will have to make a new denture for you. We have 2 options in partial dentures: cast metal partial denture or a flex partial denture. Which one suits you more? The second option when a person is missing a tooth is a bridge. So what is a bridge? Bridge is something in which we take support from the front tooth and the back tooth and we place 3 crowns that are joined together. Once in, it's in. You don't have to take it out every night. For the bridge, we usually bring you in for 2 appointments. I bring you in, numb you, we work on the tooth, we take a scan to send the scan to the lab. During that appointment, we make a temporary bridge for you. That way, you will have something over your teeth when you leave that day. We bring you back after about 3 weeks. That's when I remove the temporary bridge and put the permanent bridge on. During these 3 weeks, I tell you some do's, some don'ts, some instructions that you have to follow. So those instructions usually are no hard, crunchy, sticky foods, no nuts, no candies, no chewing gum. I want you to eat on the other side. The temporary bridge, it looks like normal teeth, but it's not till you get the permanent bridge. There are some ways to make sure that the bridge lasts you a long time. Those methods usually are: you have to get your regular professional cleanings. That's a very must. There is other way where you have to keep the area under the bridge clean. You can do it 2 ways. The first way is by using a floss threader. The floss threader works on the principle of thread and needle. You put the floss in the threader and you put it under the bridge and clean it up, pull it out towards the cheek or the back side of the tooth. That way, it makes sure that you're keeping the area under the bridge clean. The other option, the second option, is the water flosser. Water flosser is something that releases water with pressure and helps clean under the bridge. It also helps massage the gums. If you use both the floss threader and water flosser, that's going to make me the happiest. So what are the pros and cons for a bridge? The first pro for the bridge is that it costs less than an implant. Second is that it takes less time for the entire process. The entire process can be completed in 3 weeks. For the implant, it usually takes longer. For the bridge, the main cons is that you have to take support from the front and the back tooth. I usually prefer to do bridges in patients when the surrounding teeth already need crowns. Like for example, you have big fillings and those teeth are starting to break down. But if the front and the back tooth does not have much work done on those teeth, I prefer to go towards an implant versus a bridge. What is an implant? Implant is something that is placed in your bone, and once the implant is put in, we have to wait for 3 to 4 months for the implant to get one with the bone. Once that is done, we do a test which is called torque test to check the stability of the implant. Once the torque test comes good, we start working on the implant crown. We bring you in one day, place something over the implant, take a scan to send to the lab for them to make an implant crown. Then we bring you back after 3 weeks to remove the metal cap that you have over the implant while the implant was placed and then put an implant crown on that tooth. So what are the pros for the implants? The main pros for the implant is we are just taking support from your bone in that case. Implant feels much more like your normal tooth as in comparison to the other options which include bridges and the dentures. It's much easier to keep the area clean. Another pro for the implant is that you don't have to sacrifice or work on the surrounding teeth as in a bridge. You are able to eat your food much more normally as in comparison to a denture. For example, if you have to eat steak with a denture, it's going to get difficult. But with an implant, you might not even know that there is something different. You're just enjoying your steak normally. I want all of you to know that the implants have more than 90% of success rate. Once the implant is placed in and you're doing what you're supposed to do, the implant can last you forever. It takes a little more time to get an implant done, but it feels much more normal in the mouth as in comparison to the other options. Implant is a way to go, especially when you're missing one tooth and you have other healthy teeth. So you don't want to be sacrificing your healthy teeth to get a bridge versus an implant. So I hope I was able to answer some of your questions on how to go about missing teeth. If you still have any more questions or you want to schedule an appointment, you can call us at 215-725-8901 or you can reach out through our website which is mysmiledistrict.com. I would like to see you as a patient and meet you soon.